Live from the local station, News 4 Jax starts now.
Mayo Clinic now operating beyond its capacity as more people are getting hospitalized with COVID-19, and doctors continue to see the same worrisome trend.
We're now seeing a different group of people coming into the hospital. The people are younger.
Mayo Clinic has activated its surge capacity plan, allowing the hospital to place patients in what it calls unlicensed beds.
And other local hospitals continue to report a steady rise in new admissions. News for Jax reporter Janice Harris begins our coverage at 6 o'clock at UF Health. Janice, you've been walking through the emergency room to get a firsthand look at the situation there.
Yes, we had a brief moment to go inside the emergency department here at UF Health. They're working around the clock to help these COVID-19 patients get better. But the one thing that we learned about the Delta variant is that it's so much more contagious. It could infect multiple people as opposed to the previous strains.
UF Health Jacksonville, Mayo Clinic, and Baptist Health all seeing more and more COVID-19 patients, and most of those patients have not been vaccinated. And now the age range of the patients that doctors and nurses are monitoring has changed.
We're now seeing a different group of people coming into the hospital. The people are younger.
According to state data, there are more than 5.5 million younger adults between the ages of 20 and 39 in Florida, but less than half of those age groups have received at least one dose of a vaccine. 41% for 20 to 29-year-olds and 49% for 30 to 39-year-olds. Dr. Reza adds the Delta variant makes it easier to infect more people. With the original virus, one person could infect 2 people. Now it's much more.
So one person infected can infect up to 9 to possibly 10 people. So we're talking about almost a different virus.
In the emergency department at UF Health, Dr. Elizabeth DeVos is seeing COVID patients every day at UF Health Jacksonville.
One word to describe what COVID is like this year thus far.
I think it is a marathon. Everybody is working like they're sprinting. It's really a hard and difficult type of work that we're doing all the time, but it doesn't seem like it's going to let up anytime soon. And so I think that's the part that's really difficult for our healthcare workers, is that everybody's putting in 1,000% every single day.
Jacksonville's Mayo Clinic is now over capacity with patients due to COVID. As of today, Baptist Health has admitted 73 new COVID patients, including one child. There's a total of 507 COVID patients across their 5 hospitals. 95 are in the ICU. 10 are children at Wolfson's Children's Hospital. 3 are in the ICU. As of today at UF Health, 218 people are hospitalized patients as of this morning with COVID-19. Between their 2 hospitals, 56 are in the ICU. At both hospitals, 90% of the new COVID-19 patients are not vaccinated. Doctors hope people will reconsider and get vaccinated as they try to help those that are getting a more contagious version of COVID-19.
And with every doctor that I talked to today, they had 3 things. They said they hope that people will wear a mask, they hope that they will social distance, but also get vaccinated. Reporting live at UF Health, Janice Harris, Channel 4, the local station.
Janice, thank you. Right now, hundreds of people here in Jacksonville are waiting to find out if they have been infected with the virus. Many of them stood in long lines to be tested today. The wait times have prompted complaints. And News 4 Jax has learned the hours for testing might increase, and there's also a possibility additional testing locations might be opened. News 4 Jax reporter Jim Piggott is joining us from the Springfield testing site at the health department. Jim, what is the plan?
Well, right now, this is only, it's a possibility, but they could expand the hours here from 9 to 7, adding 3 more hours. Still, they have to work on that because there's a catch to all of this. Because of the pandemic, the medical staffing is short.
Crystal Mitchell was one of several hundred people waiting to be tested. She's not surprised by the long lines. She's done this before.
Well, I got tested positive about 2 weeks ago, and I'm actually a teacher. So I'm just making sure that I am positive.
Are you surprised at the testing? Like, you have to wait forever for
Nope, not surprised.
Why not?
Because I see that, the Delta variant has been going around a lot.
Mitchell, like many others, say they need to open more sites. But today, during a city council committee meeting, we learned that's not as easy as it sounds. While funds may be available to open more locations, the medical help is needed elsewhere. The mayor's office says they're working on it.
We're looking at the locations, talking to the providers, but we are prepared to work with the Department of Health and other public providers on locations. But what we can't do right now is restart administering a program that requires us to siphon healthcare providers out of a system that already desperately needs them.
The mayor and others say the problem has been those who are not vaccinated. Mayor Curry tweeted this last night saying, "Stop shaming the unvaccinated. Share the facts. We have to try and change their minds." Those in line, like Crystal Mitchell, say she's now listening.
I'm definitely getting vaccinated right after this. If it's positive, I'm getting vaccinated.
Did that change your mind, having that
Yes.
positive test?
Yes.
Have you been sick?
No, I just had no smell, no taste.
You know, no word yet of when they might expand the hours out here. But in talking to the council president today, he was there at that meeting. He says that he's working with Agape Health, and they're a not-for-profit group that are doing testing. And he says that they may expand at 2 community centers, and we could know that later this week. So this is something they definitely say they are working on. We're live from Springfield. Jim Piggott, Channel 4, the local station.